Unless good morning.
Good morning, ma'am.
Good morning. Naslia and Nusra, why aren't you coming physical classes? Naslia?
மிஸ் நான் நெக்ஸ்ட் வீக் இல்லாட்டி அடுத்த வீக்ல தான் நான் வருவேன் இன்ஷா.
Okay.
Miss,
What about Naslia?
mm, yeah, Miss. Good morning, Miss.
Good
I'm not
morning.
well, Miss.
Okay. Online students, let's start the session for today. So today we are going to look out about health and safety in baby and toddler care, right? So learning objectives of our today's session will be explain common health concerns in babies and toddlers, discuss illness prevention strategies, understand the importance of immunizations, identify safety hazards and accident prevention measures, explain the role of educators and parents in promoting health safety. So when it comes to health safety in toddlers and infants, what comes to your mind? Hygiene. When it comes to infant toddler. Here, give her the chart, huh? The early childhood chart, the stages chart. Yeah. So infant is around 0 to 1 year. Toddler is infant, early childhood. And yeah, she's confused. That's what. Infant is 0 to 1. Toddler is 2 to 3. Uh, early childhood is no 3 to 6. 3 to 6. Right? So 6 to 12 is middle childhood, 12 to 18 is adolescence. Those are the stages in early childhood, right? So we are going to learn about learning. This second module is about infants and toddlers, only for the week 1 and 2. This is the third week, right? So basically about 0 to 3 years, right? So when it comes to infant and toddlers, what is health and safety? Hmm? Hmm? Hygiene. When it comes to health and safety about infants and toddlers, what comes to your mind? Online students, please answer. Sir, so health and safety of infants and toddlers. What comes to your mind? So you all know about infants and toddlers.
மிஸ்
Right.
ஹெல்த் இதுக்கு வர்றது அலர்ஜிஸ் இதெல்லாம் பார்க்கலாம் எங்களுக்கு டாட்லர்ஸ்லேயும் பேபிஸ்லேயும்
Mm.
சேஃப்டின்னு வரக்குள்ள இப்ப அவங்க எலும்பி நின்று நடக்கிறதுக்கு ரெடி ஆகுற இதெல்லாம் அந்த விழுவாங்களா அதெல்லாம் இது அந்த இதுகள்
Yeah. That's right. You are having well experience. So what about others? Yes. You all, of course, don't have experience, but you have to know, right? That's common general knowledge. Hygiene is okay, but what about then safety? Hmm? Mm. Once again, from the beginning. Only you all should see. So for an example, your child is gonna put something onto the mouth. So you are only like seeing that. Then that's what I'm asking. So others, health and safety. Hmm. 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 It's about safety. Yeah. That's all. That's it. So common illness in babies and toddlers. Why are young children more vulnerable? Developing immune system, frequent contact with others, exploring environments through touch and taste, limited understanding of danger. So these are some of factors in babies and toddlers which they are coming from common illnesses. Vulnerable. Meaning is in the sense why they are like how to say it, like sticking into it, addicted. Yeah, we can say. Mm. So common childhood illnesses, common cold, influenza, ear infections, chicken pox, gastroenteritis, stomach infections. So common cold, of course, you all know, right? Hembil, sour, castor, those. Influenza, same. Yeah, same, but like more advanced. Sorry. So ear infections, ear infections. So ear infections mostly for infants and toddlers would happen like if they put something into the ears and everything. So if the mothers doesn't like remove the germs inside the ear, that causes ear infections like those. So chicken pox. Do you all have chicken pox in chicken pox in the sense? No. I don't know. Like thing. I can't remember the Tamil name. Nusra, can you remember the Tamil name for chicken pox? Like Amul or something.
அம்மா
Um,
போடுறதுன்னு சொல்ல
yeah, Ammam. Ammam. Not Amma. Ammam. Ammam. So gastroenteristic in the sense, not gastric. It was some like stomach infections. They might go loose motions, diarrhea, something like that. So common illnesses at a glance. At a glance in the sense, at a step like, right? So common cold, common symptoms and how to manage. Common cold in the sense, runny, stuffy nose, sneezing, mild fever and cough. Mild fever in the sense, like not too hot, not too cold, middle. That's mild fever. Huh? Between, like middle. Is there like mild, moderate, like this? There are three types of those like this. So one is can't remember correctly. The second is mild, and the third is moderate. Moderate in the sense very high. Mild is in the sense in the middle. The first word, as I know, I'll tell you afterwards. So how to manage in the sense you have to take rest and you have to keep them hydrated very. So saline drops might help and a humidifier might help, right? So ear infections, ear pain, tugging at the ear, irritability, fever, or poor sleep. Consult a pediatrician, may require antibiotics if bacteria. So ear pain in the sense they will shout with the ear pain, like tugging at the ear in the sense like doing like this. That's amma cunning. It's like that. So irritability in the sense, not like it's feel irritated, very irritated. And fever also might come basically for infants, not actually for toddlers. Infants fever might also come. And infants won't sleep because of the irritation they have inside the ear, right? So for this, you can consult a pediatrician, a doctor. So gastroenteritis, stomach flu, watery diarrhea, vomiting, nausea and fever. Right? Prevent dehydration with Pedialyte or frequent fluids, bland diet. So prevent dehydration with Pedialyte or frequent fluids in the sense you can give this one, gripe water, and Jeevani has, I know you can't give for infants. Well, this is for diarrhea, vomiting, those everything. I'm very sure about that you can give gripe water for them. So, yeah, bland diet in the sense you have to give like not liquids. Liquids in the sense you can give gripe water, some amount of water after consulting the doctor. So doctor might say you all how to give for the diet for them and what should you give to the diet for them, right? What are the foods and what are the fruits and those nuts and everything the doctor will say. So for that balanced diet, you have to continue throughout those only for the period, right? So bronchiolitis is in the sense wheezing, chest congestions, rapid breathing, cough. It's more of a like asthma, difficulty in breathing. So supportive care, monitoring breathing closely. So hand and foot disease, fever, sore throat, painful mouth sores, rash on palms and sores. Soft foods, cold liquids, and fever reduces. So hand, foot, and mouth disease. So for infants also, of course, we do have mouth ulcers, right? Mouth ulcers, patatuala, we also do have. So infants also will get that. If you give too much of hot food in the sense those seafood for toddlers and everything. So seafoods, mango, those kinds of foods, those kinds of heat foods. So for those foods, they also give like mouth ulcers and everything, right? So mouth ulcers is mouth sores. So rash and palms in the sense they will get rashes on the hand of this, right? And the feet, they will get those things. And within these fingers, they will get rashes. Croak, barking cough, hoarseness, noisy breathing. Cough in the sense, do you ever know that they will cough very hardly? They can't even talk properly. They can't even talk properly. Yeah, yeah. So they will cough like a dog barking, like that. Like that only. So that is like croak. Why are you laughing? So signs and symptoms of illness. Fever, cough, runny nose, vomiting, diarrhea, fatigue, and loss of appetite. Red flags, when to call the doctor. Because babies and toddlers deteriorate quickly when sick, contact a healthcare provider immediately if your children exhibits any of the following symptoms. Difficulty in breathing, flaring nostrils, wheezing or retractions, skin sucking in around the ribs, dehydration, no wet diapers for 8+ hours, no tears when crying or sunken eyes, fontanelle. High fever, any fever over 38 degrees or 100.4 Fahrenheit for babies under 3 months old. Lethargy, being excessively drowsy, floppy, or very difficult to wake up. Persistent vomiting, inability to keep fluids down for over 12 to 24 hours. So these are some of the red flags your babies and toddler will face, right? Not every day, some of days, a period of days, right? So if this period of days in the sense like 2-3 days, after 2 days, like if you are not much aware of that, after around like two days, you can contact a doctor for toddlers. right? So for infants, you have to see around 12 to 24 hours if they are facing any red flags within this, like vomiting, diarrhea, fever, like asthma, those kinds of symptoms, right? Preventing the spread of illnesses. Good hygiene practices protect children from infectious diseases, build self-esteem, and establish foundational life skills. Developing consistent routines like hand washing, oral care, and bathing prevents the spread of germs, lowers healthcare costs, and promotes overall well-being. So, you can practice with them with this routine, like hand washing, or like hand washing before and after your meals, before and after touching some toys or anything, right? And oral care in the sense like brushing the infant's teeth. Brushing, of course, infant doesn't have teeth, but even the like 4 5 teeth they have, you can brush it with a small tide of this. Yeah, small. But in ancient time, in the sense, in our mama, papa, those generation, they used to keep like this stick. One of a stick in the sense, not like hard one. Hard one in the sense, Arabi. Vidula to gan idal idal quote thing. From that, they used to like brush the infant's teeth in those ancient times. Nowadays, they usually have those infant brush, toddler brush like this. Yeah. And you all also have to bath them once a morning and once in the evening, 2 times. Why hygiene matters for kids? This is prevention. Frequent proper hand washing eliminates germs that cause common childhood illnesses like cold, flu, and gastrointestinal infections. Oral health. Brushing and flossing twice a day prevents cavities, tooth decay, and gum disease. Skin and nail health. Regular bathing and keeping nails trimmed remove accumulated dirt, dust, and bacteria, preventing skin infection and discomfort. Social confidence. Staying clean and wearing fresh clothes help children feel confident and comfortable around their peers. Sorry. So disease prevention in the sense you can teach them how to like hand washing, as I said before, like before and after, even when they are doing any activities or any eating, or like when you are changing diapers and everything. So you all have to wash their hands, right? So have you ever seen in infants, like they won't cut their nails? Have you seen? They won't cut their nails. The germs are in their nails. Have you seen? අර මේ හොඳට නිහපොත්ත වැවිලා තියෙන්නේ නිහපොත්තෙම all of the germs are there. Have you seen? So some of infants, of course, it is like well cutted and well maintained and everything. But some of infants are like not the like not every like cut, and the germs are inside the nails and everything. So it comes of diseases, right? So you have to like well maintain about the skin and nails, putting the baby lotions, moisturizers, and whatever they all have, and keep them very clean, right? So when it comes to like nails from fingers and toes, you have to like even an inch is like grown up of a nail, you have to cut it, right? You have to cut it. You have to see it and cut it. So that will spread of germs, will not spread of germs. Hand washing practices. When should children wash hands? Before eating, after toileting, after outdoor play, after coughing and sneezing. Cleaning and disinfecting. Regular cleaning of toys, table, floors, shared equipment help reduce germs. This is actually mother's role, right? You have to clean the toys, the table, the floors, and everything. So the infants, of course, doesn't know, here this is the germ, right? This infants, of course, doesn't know, here this is a mud floor, right? Of course, they will go run and play within the garden they have and get mud over the clothes and come to the home, right? So you have to make it sure whether in the preschool you are like educating it. As an educator, you all have to know. So to clear and clean the toys before they are touching and coming. So at least once a week, twice a week, you have to clean the toys and the tables and everything. I'm cleaning in the sense you have to water, like putting into water and some Dettol, and you have to clean it. And because every child is like holding a one toy, like if it's a bucket of toys, every child is like about to take one toy, one, two, or two toys, right? Of course, so every child of the germs are in that toys, right? So you all have to clean that once in a week, twice in a week, or before you are leaving the preschool, right? Managing illness in childcare settings. Observe symptoms, separate sick children if necessary, inform parents, follow center policies. So while you're working in a childcare settings, in a sense preschool, daycare, something, you have to observe the symptoms, like what they're having. If they are having phlegm, you have to, for an example, if they are having phlegm, you have to give a tissue for them, right? Like to prevent from other children, and you have to inform their parents as soon as possible, right? And of course, I don't know about Sri Lanka, like European countries, they do have a sick room for separately. While they get sick, they used to keep in that sick room because the infection, whatever the fever he or she has, is like spreading over the preschool. No, till the mother and father comes to pick up the child, they are keeping it separately. Is it? I don't know. I don't. Immunization. Immunization is in early childhood are a vital series of safe and effective vaccines administered from birth through 6 to protect children from serious, potentially life-threatening infectious diseases. Wait. Following an age-appropriate vaccination schedule is the most effective way to build a child's immunity before they are exposed to harmful illnesses. So what is immunization? So I hope you all know that they will have a chart for infants. Do you know? No. Yeah, book-like thing. Have you seen? Yeah, yeah. I can't remember the name called for that book. Some name. Cleaning book. No, there's a Sinhala name. I don't know. Yeah, there's a Sinhala name. That's a very unique name for that. It's a very unique name. I can't remember correctly. So on that book, the nurse or the midwife will be noted like in this age you have to take this vaccine. In this age you have to take this vaccine. So by keeping those and taking those vaccine at the correct age, at the correct step, the child's immunity will be safe, right? So by taking those immunization vaccines, the child's immunity well-being is very safe. If you are not getting the child's vaccines properly, any development delay will happen in future, right? So this vaccines is about life from infant to 6 years. Infant to 6 years, you have to get this vaccine for your kid. Not Saukya. Yeah. No one. My mom and grandmother used to fall in a very like, can't remember the name. And mama to mama. I'll ask and put it in the group. I'll add her to the group. So why early immunization matters? Disease prevention. Vaccines protect young children against severe illnesses like polio, tetanus, measles, mumps, rubella, and whooping cough. Community immunity. High vaccination rates help protect vulnerable members of the community who cannot be vaccinated, such as newborns and those with compromised immune system. Proven safety. Vaccines are rigorously tested and monitored by independent experts to ensure they are safe and effective before they are ever recommended for children. So immunization in the sense, immunity vaccines are more important to the child's immunity and for the disease prevention and for the safety, right? So if not getting the correct vaccinations at the correct time, polio, tetanus, measles, mumps, rubella, and those kinds of coughs, your kid will get on the future, right? So make sure y'all are getting and checking the book correctly after getting pregnant. Importance of immunizations, benefits. Disease prevention, reduce complications, community protection. So disease prevention in the cause, the disease which I said before, your kid will be get prevented by having those immunity vaccines, right? Reduce complications in the sense for the like you get reduce of the future problems like that, right? So community protection in the sense, of course, like protection. Of course, we are getting vaccines for our protection and for our life, right? Standard vaccination schedule. The timing of vaccines is carefully planned to trigger the strongest immune response when children are at the highest risk for certain diseases. At birth, hepatitis B. At 2, 4, and 6 months, DTaP, which is diphtheria, tetanus, and pertussis, polio, IPV vaccine, HIV, Haemophilus influenza type B, pneumococcal PCV vaccine, rotavirus oral vaccine. Why? Is it hard to remember? Yeah. So you have to write like for infants, what are the vaccines they are giving? For 2, 4, 6 months, what are the vaccines they are giving? You have to remember that, of course. Of course, so. So these are some vaccination schedule, right? So please do remember this. And at 12 to 18 months, MMR, measles, mumps, rubella, varicella, chickenpox, hepatitis A, boost doses for DTaP, HIV, and pneumococcal vaccines. Yeah. Every vaccine is compulsory. Every vaccine is compulsory for your body to prevent those conditions. Yeah. They are giving others this age you have to put is for your safety. Of course, we all don't know, right? 15, 16, those ages also they're having a vaccine. At 4 to 6 years, preschool, DTAP, polio, MMR, varicella. So these are the vaccinations you have to keep remember. Tomorrow I'll ask, huh? Why? You have one day. Huh? Huh? Oh, clean. Oh my God. Pediatric health care includes regular health checkups, growth monitoring, developmental screening, immunization, follow-ups. So, of course, when you are taking care of an infant, you have to go those clinics, right? And you have to monitor their growth, which kilo, how much kilos are there in, and how much like what is the height of the baby and what is the weight of the baby. You have to mark down that, and you have to inform the doctor, and the doctor will ask, this month how much kilo is he, like those facts. And developmental screening and immunization follow-ups. Immunization follow-ups in the sense vaccinations. You have to get the vaccination at the correct age. Minimum, yeah, 3. What is most expensive? Book photo. Nusra, thank you for sending it. The book photo. His son's book photo, I think.
Yeah.
But that is like modified, right? Not like my.
யா பேஸ் எங்களுக்கெல்லாம் இருந்துச்சு ஒருத்தாள் தான் இருந்துச்சு ஆனா இப்ப இவங்களுக்கெல்லாம் நிக்கிறது புதியது புக்ஸ் மாதிரி
Like this, see? It is well modified now. Yeah. Our chart, like. In the front, like, yeah, we have to like, but okay, bring and come tomorrow. Again, well, then we'll find out the difference with that. We'll tell Nusra to put a choreo from them. Nusra, can you put a choreo of that book from there to here? We are going to see the difference of our book and your book and Shamla's book.
நான் வரும்போது விஷா எடுத்துட்டு வரேன் அப்ப பாக்கலாம்
Okay. Baby proofing. Baby proofing should ideally be done before your child starts crawling, usually around 4 to 6 months. Huh? Huh? Ah, yeah. My 5th one. Here, my 6th one and my 7th one. Okay, happy? Yeah. Focus on high priority areas, anchor heavy furniture, lock cabinets with toxic items, gates, stairways, and should secure sharp edges. So baby proofing in the sense, before they are starting crawling or like standing up, you have to put those kinds of fences around the home, right? So because they can handle it and like crawl and everything, and they can't run all over the way they want. So because of that, you can put like a fence like this. If there is this fire, of course we don't have in Sri Lanka like this. I think like normally kids, I don't know they have or not. So you can, if you are having in future, if you are planning to keep a fire like this inside your home, so you can put a fence like that. What? I don't understand. Like this. Okay. So the fire is the feeling. You are going to cover it. How bad you are. So their toy area as well, you can cover with fences and keep the baby in a safe background. If this is the play area of the infant, like around like 10 to 12 months, you can keep the infants, make them to sit, and you can cover with the fence, right? Yeah. So that is baby proofing. Okay. Essential baby proofing areas. The living room and bedrooms. Anchor furniture. Use heavy duty straps to anchor dressers, TVs, and bookshelves to the wall. Cover outlets. Use plug covers or sliding outlet plates to prevent shocks. Soft agents. Apply soft corner guards to sharp table edge and entertainment centers. Window cord. Keep a blind cord completely out of reach using wall cleats or call wind ups. So anchor furniture in the sense wherever the TV, wherever the bookshelves, so you can keep it very covered, right? Because if there is a bookshelf and the infant is, however, she is going to take a book from that, the whole shelf will be like this only, down only, right? So for that, you can cover it and keep, or you can keep doors to keep it locked, right? So those is like anchor furniture. So cover outlets in the sense, if you all have plug points, keep it closed, right? Huh? You can keep. Because the infants are like going to on and switch this one switch. They are very like they have this phobia. Some have this phobia to go and like switch. So like my brother used, when I'm in the toilet, my brother used to come off the light and go and come again on the light and come after 5 minutes, and he'll be back and off the light and go like that only. Yeah. So that's like for infants also there's a phobia for that. Not every child, some kids. So soften edge in the sense like this edge, those this edge, the vittivalati, those kinds of some in here. This is the wall, but in some houses they used to cover it in the iron steel. So for that the edge will be like hitting in the leg or අපේ කකුලෙත් වදිනවනේ සමහරක් no, so you have to cover that also. And window cords in a sense covering up the windows, like shutting down the windows, even if there's a grill, shut down, right? So these there is some more. The kitchen. Cabinet locks, secure cleaning supplies and cutlery drawers with strong magnetic or latch lockers like Bussy or Safety First. Stove covers, using a stove knob cover so toddlers cannot accidentally turn on gas or electric burners. Like, so kitchen also, you have to cover the cutleries, the fingers, forks, spoons, all of, sorry, all those, and you have to keep the cupboards closed with a good lock, right? And stove covers in the sense you can keep the stove off and you can cover it. You can cover the whole stove If this is the stove, if this is a gas cooker you have in the home, you can cover it with a whole cloth, right? A whole, what can I say? I don't know. There's a thick cloth, do you all know? The black color one. I can't remember this. Aluminium cover. Not aluminium cover. Uh, yeah, they used to cover. That is a very thick top, big cover up. We have in our home. We used to cover that. I can't remember the name. Huh? Yeah. Yeah. What? Ah, yeah. 7 children are there, so I have to take care of them. Bathroom and utility areas. Toilet lock. Install reliable latches on toilet seats. Door locks. Use doorknob covers to keep babies from wandering into bathroom or laundry rooms. Store medication. Always keep medicines and cleaning supplies completely out of reach. Stairs and doorways. Baby gates. Install hardware mounted gates at the top of stairs and pressure mounted gates in doorways. So when it comes to bathroom and utility areas as well, you have to keep the bathroom door locked. Otherwise, they'll go and yeah, they'll go open the tap and like the infant. And then they'll go put the head in the cupboard. Yeah. Those are actually some of the facts that are happening in home. Yeah. So of course, if there's any medicines, you have to keep that cover up and completely out of children. If there is any medicines. And baby gates in the sense, this which I showed you before, the black color gate, you can, if, yeah, fences in the black color gate in the sense, like if you are having any staircase in your home, you can keep that covered in the small gate. That's called hardware mounted gates. You can cover it. In my home, it is like covered. The staircase is covered because my dogs usually go up. Right? If they go up, they won't come down. They doesn't know to come down. Right? So my mama or me wants to go up and like lift them up and come down only. If they go up, they doesn't know to come down. The big one, she does like she does know to come down. The others are like crying this like that only. So we have to keep the fence for that, like a small gate in that picture like thing. But the Coco is like, he's like going like this because they are very short. No, they are very short. Lily, of course, she can't go because she is very fat. Okay, Hershey also, the mama is not that much very like playful or not. She doesn't want to go anywhere. All she does is like eat, sleep, repeat. That's it, right? So the Coco and Lily is like however they wants to go. My brother is usually he stays at up only, right? So whenever he is coming down and going up, they also want to go up, like that. So even even if we are having a fence like that, they used to go inside that also. Yeah, that's it. Some children are like that. So why is baby proofing important? So babies and toddlers are naturally curious and often unaware of dangers. Baby proofing helps prevent falls, burns, poisoning, choking, and drowning. So falls in the sense, Drowning in the sense? Gilena. Gilena. You know Gilena? If they are like going to the bathroom inside and yeah, in the bucket, yeah. If they are going to hover and putting their what if they put their head inside? Like they will come upside down. Like that only. For an example of drowning. Now you can remember what is drowning. Preventing falls, safety measures, safety gates, window guards, supervision, secure furniture. Preventing poisoning, store safely medicine, cleaning products, and chemicals. So whatever the chemicals, whatever the disinfectants you have, for an example like morphine, Dettol, those clothing things, comfort, and everything, because they are very smelly. The infants or toddlers goes to like go and check up what is that, and they within a minute there's like this, because of that it's very smelly. Now when it comes to comfort, it is very smelly, right? When it comes to Dettol, it's a different smell, right? So they was like, what is this? Oh, yummy. And this one, yeah, or Declan, yeah, because they are very smelly and they used to know, okay, this would be very tasty for me, like that one. Preventing choking. Avoid small objects, coins, buttons, all grapes, nuts. So coins, buttons, and yeah, coin, buttons, grapes, nuts, oranges, apples. They used to put like, oh, this is good. Oh, that's it. Within a minute. Within a minute. And they used to put pencils in the ear. Yeah, no, yeah, no. And if they sees an eraser also, they will eat. Erasers. Toothpaste. Oh my God. So for this, if you are preventing choking, you can use age-appropriate toys. Right. So preventing burns, keep children away from hot drinks, stoves, irons, hot water. Hot drinks in the sense like hot coffee, hot tea. Stoves, gas cooker. Gas cooker's advanced name is salt. Irons, hot waters. For irons, they will like, oh, what is this? And keep the hand on it. But they don't know what is hot and what is cold, right? They used to like check and they know only. Preventing drowning. Drowning in the common. Drowning in the common. Safety teams, constant supervision, empty water containers, and secure pools. Emergency preparedness. First aid in childcare. Educators should know basic first aid, prevent harm, follow emergency procedures. This is for you all, huh? Educators. Miss educators. You have to know the basic first aid, right? And you have to be like very calm and very patient and deal that matter in a like very understandable way. If you are also getting confused and if you are also getting tension, then over, finished. Follow emergency procedures. So you have to follow the emergency procedures given by the child care facility, right? So they are, if you are like going and joining, they will be giving you like a book. So in that book, now after this, What are you doing? Ah, that one. Right? Okay, okay. So that only I said. Emergency contact information. Always maintain parent contacts, emergency contacts, medical informations. Right? Keep the parent contacts with you, and emergency contact in the sense those head of the child care facility and the teacher in charge, those everything, the sick room in charge and everything. So medical informations, you also have to know the medical informations, right? So what has to be done at that time as soon as possible. What? So why are you going to give the medicines to that child? At first, fever. Yeah. So that also you have to know whether he or she has these allergies for panadols, paracetamols, or syrups kinds of things. I said you in the nutrition this thing. Emergency evacuation procedures include fire drills, emergency exits, sharp responsibilities. If there's any like evacuation procedure in the sense if there's any fire, any disaster coming up, like heavy rain or anything, don't board is all. Role of educators. Role of educators. Promoting health and safety. This is for you all. Educators should supervise children, maintain hygiene standards, identify hazards, follow safety policies. Hazards in the sense some accidents, sample, if a child is going to fall or injury happens like that. So that's hazard. So these are some of the facts that educators so has you all should know, right? Observation and monitoring. Observe for signs of illnesses, unsafe behaviors, developmental concerns. Right? You have to observe if there's any illness like fever, diarrhea, or something. And unsafe behaviors in the sense if they are like in an irritation manner, they want to isolate themselves and they don't want to play, they are not very much active as before. You have to like notice those behaviors as well, right? So developmental concerns in the sense development delays in the sense like autism, ADHD, those kinds of things. Communicating with families. Share information about illnesses, injuries, safety concerns, and health practices. Uh, it is something. Role of parents. Supporting child health. Parents can provide healthy nutrition, attend health checkups, follow immunization schedules. Creative safe home environments. Parents should baby-proof homes, supervise children, maintain safe routines. Right? So when it comes to child health, you have to provide the healthy nutrition they want at the correct age, right? For infants and toddlers. For infants, the breast milk is the main nutrition. And for toddlers, the balanced diet is the main nutrition, right? And attend health checkups in the sense those clinics. The doctor will give you a date. For that proper date, you have to be there, right? And follow immunization schedules in the sense you have to put the vaccines at the correct age. Creating safe home environments, you have to baby-proof homes. Baby-proofing. Can you remember baby-proofing? What is baby-proofing? What is baby-proofing? Don't know? Baby proofing? Baby proofing? This word? Baby proofing? You all don't know? No, seriously, I'm asking.
Miss, the gate addition இதாக்கி
Wait,
பாதுகாக்கணும்
Nusra,
சொன்னது
wait, Nusra, wait. No, wait, Nusra, you wait. What is baby proofing? Rashna, what is baby proofing? Nehla? Wait. Doing? No, tell me correctly. You also wait. You all tell. What is baby proofing? Seriously, I don't know. What? Putting that fence. How we all can forget this thing in a second? It is correct, but not the correct one. No, Nusra won't repeat it. Nusra left the class. Yeah, I'll be sending it to the group. Nusra doesn't know anything. Why, for what? Wait. I'm still explaining yours. What finished? Okay, is there any doubts that you have to clear up? What? Only 1 hour. 11:05 I started and it's 12:07. Why? Online students, do you all have any doubt?
Ma'am.
Gino, sorry.
No, ma'am.
Okay. Umesha, where is Riska today?
No, ma'am. I informed. I messaged her, but she didn't reply.
Okay, now we all can do activity 1. Y'all can start doing activities and pass me the book to check. Why? I'll call him. You better to ask him. Do the activity. Yeah, I'm asking not. Okay. Notebooks? Okay. So you can buy this from Jaya Book Center and go, no? So, Miss Leshna, where's the old book? I mean, the module one. Ah, yeah, that's it. Yeah. No, it's like okay.
Ma'am, can you leave?
Umisha, did you said anything?
Ma'am, can I leave, ma'am?
Ah, yeah. If you're done, you can leave.
Yeah, ma'am, I finished. I have sent. Thank you, ma'am.